I'm taking classes addicting drugs. You want to learn about how medicine is used in references through Harry Potter. We've got a class for that. We've got a class for philosophy of medicine, and absolutely love it. So a little bit of everything, and the versatility is why I fell in love with the pharmacy program here.
The pharmaceutical minor has really helped me just get more in depth with neuroscience. I'm really interested in addictive drugs, and so we've touched on that a couple times. So getting both angles, like the pharmacy side as well as the neuroscience side, being able to kind of connect them and see the overlap has been really great to be able to have both of those at the same time.
In my upper level neuroscience courses, we talk a lot about cutting edge research for neurodegenerative diseases, and we talk about new treatments, and the professors always ask us, what do you think the next steps are for these treatments? Where should the researchers go next? And because of my Pharmaceutical Sciences minor, I know exactly what the researchers should do next. I know a lot about clinical trials and FDA approval.
I added a pharmacy minor after my first semester of freshman year. I was in addicting drugs class, and I was like, oh my goodness, I need to do this. I need to do this. We're learning about like Schedule I class drugs and like, how addicting they are, the pharmacodynamics, the pharmacokinetics about it, and that just, I always had a fascination with pharmacy, so that kind of topped it out for me.
One of the classes I got to take through OSU's Pharmaceutical Sciences minor was the history of vaccines, which I felt like was really applicable to my own daily life because I work as a pharmacy technician, and pharmacy technicians can also be certified immunizers. So I really felt like I was applying what I was learning in that class, especially about the coronavirus vaccines, to my professional life.
Favorite, I took it just kind of on a whim. It went counted toward my minor, and it also counted towards as a GE, and it was addictive drugs. And that was over in Rife, and it was my most favorite class of all times. Like, it was incredible. My teacher was great. I had Dr. Mefford, and it was just so engaging. It was just really fascinating, kind of like a full circle, like, yes, this is what I want to do, this is my calling kind of moment.
I'm working on research. I'm actually working on a trial here with the Department of Psychedelic Research, and we're doing a clinical trial on PTSD war veterans, and basically microdosing psychedelics to try and treat their mental health disorders. So kind of what I want to go into with the clinical trial. So it is nice to have that up my sleeve here early on.
2 of my GEs have also counted for the minor. So it's been like half of my minor courses also correlate to a GE course. So that's been really great because it's just a way for me to make a GE course something that I'm passionate about, but then also help me work towards my minor. And then my other 2 classes that I found were just ones that really spoke to me. So for me, it doesn't really feel like much work. It's 4 classes, but they're all things that I'm very passionate about, have helped me get towards my GE goals that I would have needed to do anyways, and have just been a really good reminder of what's important to me and what I want to do, and help renewing that passion every day.